Good afternoon. My name is Antoine Court. I'm here with GRIP, and I work with GRIP doing the outreach. And we have been in contract with the nurses out of San Francisco. Thanks to the efforts of Director Kathleen Sullivan here, we're going to go out there and we're going to give them food, take their blood pressure, and make sure that their health and wellness is good, and navigate them to other things that they may need as far as their health and wellness. But we have food, we have masks, we have information about the COVID virus, how to use the mask, how to wash the mask, how to wear them correctly. So GRIP is out here doing this homeless outreach. We're going to go full force this year. We're going to service this community in a way that has not been served, with the direction of our fearless leader, Kathleen Sullivan.
So I just want to acknowledge San Francisco State University, who GRIP has an MOU with to provide this kind of just really medical eye on our homeless community. And this wouldn't have been possible without one of our faith partners, and that's Sojourner Truth. So giving a shout out to Sandra Trammell with Sojourner Truth. We are a faith-based coalition, and without the coalition, we would not be able to do this. We also have with us Stan Bias, who is a longtime employee of GRIP, but does his own outreach work outside of the boundaries of his 8 hours here. He is in the community feeding all the time anyway, so we're blessed to have him as part of the GRIP team and here helping us with this outreach now. This work has gotten really tricky. It's gotten very different. And so the masks, as Antoine has said, are important. The knowing how to wear them, knowing how they can come back to GRIP for resources still. They still can come here for food. They'll soon be able to come here and shower. And then to have somebody that's taking their pulse, their temperature, and everything out in the encampments. That's just so important, because if in fact they meet a threshold in terms of health disparities, they may have action in going into one of the local hotels. They may not even know they can because of the fact that they're out there and they're very sick, and the outreach team may have missed them. So this will be an every couple of days a week, like we have been over years and time. We had to stop with the COVID-19 for a minute to recalibrate how to do this, but we're back in business.
Okay. So I'm one of the nurses here from San Francisco State. This is our 4th semester community nursing assignment. And so basically what we're doing is going out to the community and, providing blood pressures, respiratory checks. But it's actually a big thing for us nursing students. Nurses think that our job is in the hospital, and this GRIP kind of gives us a chance to realize we can reach the community on such a more personal level and on a bigger scale level, and hopefully with some of the work we do kind of prevent some of these people from going into the hospital, with just giving them the basic education and knowledge when it comes to their health.
I'm also a nurse from San Francisco State University, and I'm really excited to be here. I think it's very important to be out in the community right now, the way that things are going, to help stop the spread of coronavirus, be able to provide masks, check their temperature, check their health, and see how things are going, and just be able to provide some sort of medical service to them, as well as giving them food and toiletries and things that they need, the basic needs. So I'm excited to be able to be a part of that and be a part of this team at GRIP.
Hi, my name's Landreth. I'm also an SFSU nursing student, and I feel really privileged to be working with GRIP and going out to all the different people in need in the community that, especially during this COVID time, there's a lot more people out on the streets just because shelters are shutting down around the city. So I feel really good being able to give something back, especially because I'm not only a nursing student, but I live in Richmond. So it's been really nice having this experience with GRIP.
And as you know, I always leave with a good cliche. Teamwork makes the dream work.